Hello, my name is Carla Harrison, and we are the Wellness Plan Medical Center's Team B. Our winning team covers the areas of medical, pharmaceutical, nursing, engineering, and my area, social work. Together, we have created an application to address diabetes. Each one of you has helped us create a better understanding of diabetes and an even better perspective of how to approach diabetes. Diabetes has become a major issue in our world. Diabetes is a disease that affects how the body uses glucose, a sugar that is the body's main source of fuel, which means the body either cannot make insulin or insulin does not work in the body like it should. Diabetes has caused over 70,000 deaths in the US alone. Each day, there is a family that stresses and has complications with dealing with diabetes. Family involvement can help prevent the large amount of deaths in the US as well as the rest of the world. This can be prevented in a social manner by having family management, awareness, and knowledge. Looking at diabetes through a social worker's perspective can help create a secure family affair for dominating diabetes. The effects of diabetes can be prevented through family management with care and warmth, organization of conflict and expression, and family involvement. This means every family should have a way to control and keep everything in order without creating a discombobulated environment. With the help of the app, a family will be able to take firm control through blogs, schedules, and information. When having a diabetic in the family, you must maintain awareness. Being aware of the effects of diabetes can help a diabetic feel as if they have a well-built family support system. Adapting to diabetes can be difficult and can cause many family problems. To solve those issues, the app includes tips from health professionals. Having knowledge about diabetes can give all the needed information to understand the aspects and the awareness to create a better bond within the family. The app will include the information needed to understand diabetes. Normally, the doctor is the first person the patient speaks to. So, therefore, I am going to ask the doctor to speak at this time.
I believe everyone has been to the doctor and understands the importance of working closely in partnership with your doctor. As a doctor, I am at the center of a patient's care, coordinating and guiding the patient and their family through what can be very confusing and fragmented care system. Along with that, my role is to diagnose, provide treatment, and help my patients manage their diabetes. In spite of any system challenges, I'm directly responsible for providing a positive patient experience by putting the patient first along with the comprehensive care through all stages of diabetes. Standard of care for diabetes including recommended lifestyle changes and choices, including smart dietary choices, staying active, and using the prescribed medication. After a diagnostic, I discuss medications, prescriptions, and treatment plan with the patient and the nurse. I would like to reinforce our Dominate Diabetes app is created to help my patient and their family. I would like to reinforce that our Dominate Diabetes app is created to help my patients and their families learn, understand, and better manage their diabetes. What I do for each of my patients can involve interaction from social workers, pharmacists, engineers, and certainly will not work without the support and assistance of the nurse who will also tell you more about the application.
One of my key responsibilities as a nurse is to effectively communicate with the doctor, but it's also up to me to foster a personal relationship and partnership with the diabetic patient and their family. It's a family affair. Nurses assist the patient and their family through the management of the patient's diabetes at all phases, from early childhood to mature adulthood. Prior to offering assistance, though, the nurse must first ensure that the patient is aware that they're at risk of or even have diabetes by then. The patient and their family should also be aware of these risk factors of diabetes, which include but are not limited to heredity, ethnicity, sedentary lifestyle, unhealthy diet, and obesity. The nurse must also inform the patient and their family about the potential complications that may arise when diabetes is not managed properly. These complications may be things as severe as blindness, amputations, and renal failure. On the Dominate Diabetes mobile application and website, charts will be provided so that the patient will be aware of what their ideal weight should be, what is the appropriate daily caloric intake for their height and weight, tips for more active lifestyle, and healthy meal plans. Nurses also discuss the medicine regimens of the patient and the family. The pharmacist will provide more detailed information about the medications available to diabetics. She will also talk more about the mobile application and how it pertains to pharmaceuticals.
As a pharmacist, it is my job to counsel the diabetic patient and educate them along with their family on the proper medications and the proper dosages. Not only do pharmacists distribute medications, they also monitor the various medications and how it affects the patient's body. The main medications that a type 2 diabetic are likely to take are Novolog, Lantus, and/or an oral supplement in pill form. As a whole, the pharmacist can help guide the family by counseling them and educating them in the proper ways to support, love, and show affection towards the diabetic in the family. Along with our It's a Family Affair application, diabetics could have a new outlook diabetes in a much more positive way. As a whole nation, we all need to come together as one big family to help dominate diabetes. One way you can get information on diabetic medication is to log on to our application and click the tab Diabetic Medications. There will be provided a list of all the medications a type 2 diabetic will have to inject or use in an oral form. Now I will turn it over to our well-trusted, hard-working colleague over in the engineering field who will give you an historic and more technical understanding.
The history of diabetes has come a long way since 1910 when Sir Edward Albert Sherpa Schaefer and the study of pancreas, which leads him of the discovery of insulin, which will later be found in diabetes. All the way into the 21st century, where diabetes was taken just a little more serious and new innovations was found, such as insulin pumps, insulin syringes, insulin pens, and glucose readers, which later became known as glucometers. Glucometers and insulin pumps could be ranged from $20 all the way up to $1,000. With all this new technology, we still have faults, like the insulin pump is bulky and heavy. In addition, a portion of the pump needs to be implanted in your skin and you're not permitted to clean it, which are at high risk of infection. Diabetes has a lot of complications. From an engineering perspective, like nerve damage, poor blood circulation, and skin sores. If not properly caring for your diabetes, limbs will get amputated. This is very serious. There are companies which have created innovation devices like the microprocessor controlled knee, which enables amputees to walk through various terrains, called the C-Leg, which includes a wireless remote which electronically locks that you can stand straight up. There are many new innovations engineering develops on the horizon to help treat diabetes. If your family are affected by diabetes, our Dominate Diabetes app allows you to connect with more people just like you. Connect, learn, and actually dominate diabetes.
The Wellness Plan Team B thanks you for your attention and the opportunity to share what we've learned about diabetes during the C2 Pipeline program.